This slide is an excellent one to use to start the presentation. It makes claims about effectiveness of focal therapy and highlights the contributors to why now is the time for focal therapy. The overall message for this slide is that any hospital that consider themselves an owner of a comprehensive prostate cancer program needs to offer a focal options to patients. Hold your ground on this slide when discussing the functionality and clinical efficacy of HIFU for prostate cancer. Clinical evidence later in the deck why we feel strongly about the 5 statements. When presenting a slide to a customer, start with the key message and use the talk track to provide context and support to the key message. Talk tracks provide general guidance to present the slide and support the slide's key message. Tailor the talk track to the customer and personalize the delivery. The talk track for this slide should support the statement that focal therapy needs to be part of any comprehensive prostate cancer program. Explain why the statement is fact. For this slide, the talk track should include a mention of positive clinical evidence and business impact of adopting a focal program. Slides are excellent tools to leverage when asking the customer specific questions. You should prepare 3 to 4 probing questions. The probing questions for this slide should uncover the customer's opinion on focal therapy and explore how patients' expectations and priorities have changed in recent years. Examples of probing questions are: have you incorporated focal therapy into your practice? When, why, and what was the result? How have patients' priorities or expectations evolved in the last 10 years? What trends have you noticed? How has the diagnosis and treatment of prostate cancer changed in the last 20 years? How has that changed your care model? These types of questions will also help you understand their treatment philosophy and how they stratify risk. As you structure your slide deck, prepare a transition question that will set up the next slide. The surgeon's answer will lead to a natural transition point. Remember, preparation is key. This strategic slide is meant to reinforce the extent and consequences of prostate cancer. Also, it highlights the opportunity available to first-to-market hospitals and surgeons. Emphasize the role that men's health and prostate cancer has on a comprehensive cancer program. Men's health is a strategic pillar for any hospital system. The talk track for this slide centers around statistics and how many families are impacted by prostate cancer in the United States. It's important to highlight the 3 million patients living with some stage of disease and relevance to a focal program. Ensure you discuss the strategic value a focal program provides to the hospital and start to create a sense of urgency. Probing questions to ask on this slide are: what tools do you use to risk stratify a patient's disease? How has your treatment algorithm changed in the last 10 years? What is your active surveillance protocol? How often do patients get their PSA level tested and a biopsy? How many patients are currently in your active surveillance protocol? The local market opportunity slide is a strategic resource to get the customer to start thinking about the local opportunity. This is the slide to use to make the customer start to see the consequences of inaction. Really use this slide to build a story around the limited opportunity and to create a sense of urgency. There are 2 key messages for this slide, depending on the local market conditions. For a greenfield market, without a Focal One system, the message is urology has proven the ability to consolidate markets. You have an opportunity to be first in your market. Most have seen or have at least experienced the impact that the first movers in robotic prostatectomy had consolidating the market. We are seeing similarities between how Da Vinci was first embraced by the urology market and how Focal One HIFU is being adopted by the urologic-oncologic community. The second message is for those accounts with a Focal One system in the market. This is an opportunity to be compelling and leverage the agitation within the market. As with any slide, tailor the story for the customer. There shouldn't be anyone in the room more prepared to discuss the local market dynamics, influencers, and opportunity than the person delivering this slide. The talk track in these circumstances is all about consequences of inaction. If we are doing our jobs correctly, the institution in the market with a Focal One will have already created some urgency with a strong, omni-channel marketing campaign. Therefore, there isn't a need to hit them over the head with the consequences or put them on the spot. They know it's there, and if they haven't lost patience yet, they will. So, just casually mention the programs in the market and use as a local reference story to show what is possible when committing to building a robotic HIFU program. Some probing questions to ask on this slide. What is the department/hospital's strategic priorities for the next 24 months? Is growth important to you? What are you doing to grow your volume? When was the last time you had something exciting to talk with referring physicians about? The patient testimonial slide captures our entire story in a short news segment. The key message should sound familiar. It is focal therapy for localized, intermediate-risk prostate cancer is a patient-driven phenomenon and a great opportunity to differentiate and market the hospital with an appealing value message that resonates with a large audience. Take advantage of any opportunity you must. Highlight that this is patient-driven technology. Patients have a very simple value equation. They will seek the therapy that effectively solves their problem and can be delivered in the least invasive approach possible, limiting the procedure's impact on their quality of life. Some physicians will be familiar with this equation as patient value equals efficacy divided by invasiveness squared. Some talking points to consider as you build your talk tracks include: 1. Focal therapy is a patient-driven phenomenon. 2. Patients will seek the treatment that effectively manages their disease, while limiting side effects that impact call. 3. The patient in the video we watched sought this treatment and flew from Madrid to USC specifically for Focal One HIFU. 4. Satisfied patients are evangelizing the technology. They become advocates and spokesmen for the surgeon in practice that used Focal One HIFU for their prostate cancer. Use this slide to learn more about the surgeon's priorities, how they approach the disease, and will learn a lot about their patient population. Some questions to ask include: 1. How have you seen prostate practice grow in the last 20 years? 2. What drove the success/stall? 3. How is your compressive prostate cancer program promoted? 4. How often do patients travel to receive treatment at this facility NBSP? 5. Have you seen any changes in referral base in the last 5 years? 6. Do you actively engage/educate referring physicians in the community? Consider using the installation map slide anytime you leverage this tool during a conversation with a customer. It is a strategic resource that almost speaks for itself. The core message on this slide is Focal One has been validated and is in use at both prestigious academic centers and community hospitals. More than anything else, this slide validates that the best cancer institutions in the world consider Focal One to be the HIFU therapy of choice for prostate cancer. Pause. Let it sink in. Allow them to look through the map and appreciate the spectrum of institutions that use our technology, from the Memorial Sloan and Cleveland clinics of the world, to regional IDNs like Prisma or standalone private hospitals like Hoag. 1. Some talking points to consider when presenting this slide /. Focal One is being adopted at some of the most prestigious cancer centers in the country, while also being successfully adopted at community practices. 2. The clinically efficacy of Focal One has been validated by experts at places like Cleveland Clinic and UCLA. 3. Focal One's ease of use and clinically outcomes has resulted in more SWO fellow programs choosing Focal One over other HIFU technology platforms. Use probing questions on this slide to learn more about the customer's influencers. Learning who they respect and their influencers will help you learn this clinical priorities, approaches to prostate cancer and comfort with new technology. Some questions to consider: what is most important to you/hospital when evaluating new technologies? What is your evaluation criteria? Do you have friends or colleagues practicing at any of these institutions? Have you asked them about Focal One? What institutions or opinion leaders do look to when deciding to try new therapy or technology? The UCSF ROI and business case slide provides about as good of a reference story as you will find in our industry. This strategic slide tells the story of a practicing urologic oncologist and CMO at one of the most prestigious cancer centers in the world, whose reality far exceeded expectations. The key message on this slide is building a robotic HIFU program is an economic win for the hospital, and we can prove it. Setting up this slide and introducing Dr. Crocitto as the main character of this story is critical to making the slide as impactful as possible. The talk track should include the following key points. 1. Laura Crocitto is an SWO Fellow AMP, CMO for the Diller Comprehensive Center at UCSF. 2. She determined that UCSF needed a Focal One to complement their compressive prostate cancer program. 3. Initial business plan called for a 2-year ROI, 2 cases a month. 4. Experienced rapid incremental volume with the introduction of Focal One HIFU. 5. Experienced clinical value in offering HIFU to intermediate stage prostate cancer patients on active surveillance. 6. The actual ROI was 1 year, averaging 5 cases a month. Use probing questions on this slide to learn more about the capital acquisition process, the strategic priorities of the department and hospital, and what their current plan is to meet the strategic priorities. Use the following probing questions when presenting this slide. 1. What are the hospital, cancer center, urology department's strategic priorities for the next 2 years? 2. When was the last time hospital introduced a new, revenue-generating service line? 3. What are you doing to grow the practice now? 4. What institutions or opinion leaders do look to when deciding to try new therapy or technology? 5. What investments have been made into your cancer center?